Welcome everyone to the Wednesday morning series. Dr. Skip Speer is joining. Hello, Dr. Skip.
Good morning, Tammy, and nice to see everybody today, or to be here anyway.
Yeah, yes, yeah, exactly. We always appreciate. I always see lots of familiar face or familiar names, not faces on this. So these are recorded. So if you're watching this video later, you could join us live on Seeking Integrity. You'll see a whole list of various webinars, and you can come join live, ask questions directly, and then those are posted, to our YouTube channel. We have I looked at, a little while ago, and we had like 1,300 videos. I know I spent quality time on a weekend, and I was like, okay, but but we have so much content because we really do care about people getting help and healing, and we want to have valid, information and resources, for people um, on this path. This is a difficult journey. We're asking people to do things completely opposite of the way they've been doing things that helped on some way, maladaptive coping mechanisms, but was causing a lot of pain, in its wake. So giving real information that can help you on this journey is what our goal is. So we don't have any questions. So interestingly, I will share this because I was reading an article and I thought this was interesting, and we really do prefer your questions. But it was on doom scrolling. Have you heard of that? Oh,
Sure.
see, I had not heard of it. Doom scrolling and hope scrolling, and I like the hope scrolling. So, and so the premise, and this came from Dr. Louise Stanger. So I'm crediting her on this. She's done a podcast with Dr. Rob, on the podcast as well. But she's saying when we are doom scrolling, where our threat detection is activated, anxiety increases, more negative content consumed, hopelessness grows. And so, how do you counter? Oh, and guess what? All those algorithms know what you're scrolling. So they're going to pile on and give you more of the same content so that you keep clicking. So it just piles on. So then she said, hope scrolling. And she said, with hope scrolling, it's like the opposite. Your improved mood and resilience, better sleep and less anxiety, increased sense of agency and hope, more positive conversations with friends and family, social media algorithms that begin showing uplifting content. And she gave some ideas on how to do this. She's just talking about quad scrolling. And I was not familiar with that, but that's apparently a system, where it's an AI thing. So, but I'm confident any AI thing, you can do that. You start asking for recovery stories and or positive stories. You request daily affirmations or coping strategies tailored to your challenges. Generate personalized gratitude prompts or mindfulness exercises. I loved that one. And explore evidence-based treatment approaches and hope-filled research. And so, and she also had for family and loved ones, research interventions, success stories, and family healing journeys. I like that one because lots of people go, "Oh, this is never, they're never going to get better. It's always going to be like this," and you get caught up in that. Find resources for self-care and boundary setting. Discover communities and support sessions and support groups in your area. Learn about the latest advances in addiction medicine and therapy. Again, looking for positive. And then she even had some resources for professionals. And so, good stuff for professionals to continue to grow. But she said the neuroscience of hope, and I love that she pointed towards neuroscience. It activates the prefrontal cortex. It's where our rational and problem solving brain is. It releases dopamine and serotonin. Oh, when we're addicts, we're chasing all of those things. So, guess what? If we're leaning into the hope, we're finding that. Reduces cortisol and stress hormones. And for partners, I hear so many people that are struggling with medical conditions, and I don't have my research study, all set, but I really do believe that constant, stress and cortisol, is at the root of some of that. And it strengthens neural pathways associated with resilience and optimism. So like all of these good things happen but I was thinking about this. It takes intention, you know, because we do get caught in that. Oh, I got to know about that. I got to know about that. In that news. And I was really intentional. Like this was at the beginning of COVID. I quit watching the news. It was so negative, and I was finding myself all stressed out and anxious about, and just all that negative input. And I have a really good therapist, and she was like, "You need to be intentional." And so as part of my intentionality, I chose to disconnect from news, and my husband is a news junkie. I'm just going to own it for him. And so I would tell him, these are the kind of things I would actually want to know about, and then the rest I don't, and so he would give me, information if I needed to know about something. So and it's worked for me. Obviously, that's what, 5 years now of like, you know, it has positively impacted my world to not be following all of that negative. I look for things of gratitude. I look for, hopeful stories. I am intentional about unplugging. If I find it's causing some body reaction of negativity in me, yeah, that's not, I don't need to finish the story. I can just, go away. So I really appreciated that, and I hope that that's helpful for some people to maybe consider, am I following that doom scrolling, and can I shift to go to a more positive message?
And you got to it at the end, Tammy, but what I was wondering is a lot of us, myself included, can, get on the cell phone and do it to kind of numb out. It's the
Yes, that's a good point.
opposite of like, intimacy is we're kind of numbing out with this thing. And what I heard you say with the hope scrolling, what an amazing word, is that there is intentionality instead. So we are actually possibly being present for that and doing something to heal ourselves instead. And so that, what a great concept.
Yeah, and again, Dr. Louise Stanger, I'm pulling it from, her email, because and I was so caught with that. I was like, oh, that is so prevalent, and I hear, I have lots of friends who are like, oh, everything is so terrible in the world, and I'm like, if you really study history, I don't know one period of time when everything was perfect in the world. And so to go down that path is not good for me. To go to, I just had an amazing positive experience, with somebody, shared a really positive thing, and I was like, oh man, and that feels good. And that was their experience. It was a real experience. So, if I'm choosing those things rather than the negative, and I know enough brain science of like, the brain is looking for, I need to know if I'm safe. I need to know if I'm safe. And so, we are chasing that. So, but I'm telling you, as somebody who chose, specifically to unplug from all of that negative, I don't regret it, and I haven't turned back. I haven't gone, oh yeah, now I've been off it for a few years and I should go watch the news or whatever. I don't need it. So okay, we have a question. I'm going to put that. um oh, what is the difference between a CSAT and regular therapist? Is it important to activate that even if you've been with a therapist for years prior to this? I love this question, and Dr. Skip can speak to it, and why and how. I'm going to use the word hounded. How I hounded him to finish the CSAT.
Well, and which is aging both of us. So Tammy met me, I
We were a
in
little younger.
mod one, in module one. So there are four modules for CSAT. So long before I was a CSAT and long before I had a PhD, we met each other. And she really did encourage me. I had taken the first couple of modules and then taken time off, and she stayed on me. And Tammy is such a huge advocate for CSATs behind the scenes. If I may say, she's probably more connected than anybody else, knows all the CSATs, knows their practices, can connect people with CSATs regardless of where they live, that sort of thing. That being said, so what is CSAT? It stands for Certified Sex Addiction Therapist. The gentleman that kind of started the International Institute for uh, what is it?
Trauma and addiction
Uh,
professionals. ITAP.
Trauma and
IITAP.
Trauma and Addiction Professionals is Patrick Carnes. So he's kind of the father, grandfather of the field. And so what we do to become a CSAT is go through four different modules that are 40 hours apiece. And we have time in between, 30 hours of supervision with that. And so what we're doing is we're specializing in treating sex addiction, and we get a lot of exposure to betrayed partners at that time too. So I hear that if you have a therapist for years, I don't necessarily want to tread on that relationship, but there is a nuance that a lot of therapists don't get. Again, myself included, I had been licensed for 20, 25 years before I became a CSAT. And I thought I was doing the work, with clients because I had done substance recovery, so much of that. But there's so many different nuances. And I think the most important one is the partner stance, the betrayed partner stance, where I think that I would have taken maybe the 12-step stance of why does she need to know that? Let's not hurt her, that kind of thing, instead of learning that it's not my decision to make, to hurt her or not. This is her right of truth. And she needs this information to be able to make informed decisions, informed consent to stay in the relationship or not, to feel safe, that sort of thing. So there are just major nuances that very well meaning therapists don't get, that I may say that CSATs do. Tammy, what did I miss?
No, no, you got it. Well, there's continuing education too. It's like it isn't like once you're a CSAT, you're always a CSAT. You have to continue to learn. And so there's a continuing education that's required every 2 years to maintain your CSAT. So this is highly specialized field, and it needs to be because, there's 20 different subtypes of, sex addict. So you want to understand those nuances. I often say, if you have cancer, you want the cancer specialist. You have a nice GP, you really appreciate that person. They, getting, a checkup and, your blood work and all of that, fine. But when you've got something really major, you want the help and support. Now, the nuance for betrayed partners, if somebody is a very good trauma specialist, they can often navigate that space and understand. But I still hear from some partners that their nice trauma specialist is doing the oh, you should just leave him. Well, that's not the right message. Um and I will say, yes, I know I'm not kidding, thousands of therapists all around the world. And there are a number I refer to, and there are some I do not. So I get requests. I probably make 100 referrals a week. And you can email tami@seekingintegrity.com. But tell me where you're located and what you're looking for, if it's for the betraying partner or the um, uh, betrayed partner. And if you say, we're looking for a couples therapist, I will say, ask your individual therapist. And if you're saying, here's how the emails go. If you're saying, well, we don't have individual therapists, I'm going to say, please start there, because the therapy for the betraying partner and for the betrayed partner are so different early on. And someone used this analogy a long time ago, and I wish I remembered where I heard it because I would give them credit. But they said, if you go to couples therapy early in the process, it's like two of you being in the rowboat, and partner, you're paddling like crazy, and addict partner sitting in the back, you kind of looking around, and guess what? The boat's going in a circle and you're not really getting anywhere. And often people are, it's making things worse. And particularly if you have couples therapists who aren't specialized in this area, that really adds to it's probably not going to go well. So the resources that we have on our site, that we work really hard at having legitimate resources that are helpful on this journey. And guess what? Everybody gets to choose their path. I often hear of people who chose to do things differently, and I often hear it didn't go well. And but everybody gets to choose. So it's not a judgment thing. It's just, we want you to heal. We want you to have, like, this is hard. So we want it to make it as soft a landing as we possibly can for both of you. So that really motivated, and you're seeing, oh, this is starting to get better. There's a lifeline to healing for both of you. So do you have to, set aside your other therapists? No. But here's the other thing with therapists: you can't have a whole bunch of therapists. I can't remember all the rules of that, but if someone is if if this therapist doesn't do what you need as a specialty, then you can have multiple therapists. They should be talking to each other. If um, but it also can be a little bit of you'll get conflicting information, so that makes it a little harder too. It may be that you go, I'm going to press pause on this for just a moment and go get the support. So I don't know, that would be something for you to explore. Do you have thoughts on the
A
multiple
hundred,
therapist thing?
100%. And then I want to circle back to something else, but I actually can share an experience that I have of working with other therapists. And I agree with Tammy. The most important thing, if you have more than one therapist, to do is to coordinate care. And sometimes we do a bad job of that as therapists. So kind of put some heat on us to do that. So I was working with a client. I was preparing him for disclosure with his wife. He had a psychologist that he was seeing. I was trying to coordinate care with her. I thought she had a relatively good understanding. And on the day of disclosure, I actually went to Dan Drake's office to do a disclosure. It took all day, 8 hours to do a disclosure. And Dan has a different perspective. I don't want to speak for him on disclosure, but basically it's whatever the partner needs to feel safe. And I like that. And so we kind of hung in there and did that. But before we did the disclosure, he said, my therapist told me that before disclosure, I need to say that I'm not sure whether I want to stay in this marriage or not. I think I might want a divorce. And at the end of 8 hours of disclosure, the partner said, "You've got your divorce." And if he was my client, and if he had told me that, I would have said, "You have no idea what you want. Don't make any major decisions for the first year. Our thoughts and feelings go up and down." I really think it was premature. I don't think that they necessarily should have divorced, but the therapist thought that she was doing the right thing and was saying, "Well, if you're on the fence, you need to tell her." And he was on the fence for that minute, but I had seen him the day before and he was all in, kind of thing. So that's kind of an example of therapists, undoing, well-meaning therapists undoing the work. Do you have thoughts about that, Tammy?
Well, you saw my jaw drop. Yeah, that was like not a, yeah, like that was, well, that's sad, because there could have been, like to go through, back, when divorce is on the table, like a disclosure isn't even recommended so to go through all of that, to have that outcome. Often people are willing to put the relationship in safe harbor for 60 or 90 days, so we can figure this all out, let everything settle, get go through the impact letter, go through the restitution letter, and then have more information. And if the headache partner is doing the work, often you're going like, wow, we're seeing things progress in a positive way, not linear. It isn't just like, oh, it's up and down, and but things could be really different. So I'm sad about that, particular situation. Wish them all, good things, on their journey forward. I hear often about people who are talking about, they're on their whatever marriage, third marriage, and I didn't have to lose my first one if I'd gotten the right help. Like, and you can tell there's longing, like that was their person and they really wanted to be in that relationship, but they didn't get the right help. So again, why I advocate, for getting qualified help, and not every CSAT is the same. Like I said, there's some that I don't choose to recommend. They have letters. And I was vice president of ITAP for 10 and a half years, but I watched at the trainings and I saw the people that were there for the letters. And we often said you can make a good therapist, a really good CSAT, but you can't make I'll use not good therapist instead of bad, a not good therapist into a good therapist. There's, so this is very different work than, and Dr. Opp says this all the time too. If you're depressed, grandma died, and you're grieving, a generalist therapist that can support you in that is very different work than someone who needs the accountability. Like this work is very structured. He just did a training for ITAP, and there were a number of therapists who, many of them have been trained, and they were affirmed that they were doing the right work because they were holding the accountability. They were challenged because they're like, I need to, you like, I can do this work better. Great, but they were really appreciative of his, going, this is, he said to the therapist, it's feels better to comfort than to confront. And you can confront with love and caring, but at the end of the day, this is how we change is we need to be held to some degree of accountability. One more thing, and I promise we'll go to the next question too. But I hear partners going like, he's going to his therapist, and he loves his therapist, and I'm using genders here. He loves his therapist, and I always go, if he really loves his therapist, I'm always concerned that it's like there isn't enough accountability. You should respect your therapist. You should know that this person can help you. Do you have to love them? Probably not. But you can love that they're helping you move forward. Okay, so that's one thing. But then also that the partner is going, I don't see that they're making any progress. So they've been going to this therapist for a couple of years, and there's really like the partner's hopeful, but they're not really making any progress. But addict partners checking off a box, well, look, I'm seeing my therapist. So all of those things, can be challenges. And I think it's okay for a partner to go, okay, I'm holding my boundary of like, I'm looking for you to be making some progress on this recovery journey, and you can like your therapist and stay with that. And I'm going to be over here holding space for me in this whole journey. So that was a
And
lot.
if I may, the next
Please.
question is just actually kind of a recommendation. So I'll circle back. Um, so Tammy, being at ITAP for 10 years, sat through all of the modules, and Tammy's knowledge is amazing, if I may say, and I have so much respect for
Thank you.
you, Tammy. And so Tammy is quoting theory that we're taught at ITAP, which is if divorce is on the table, um, disclosure is not recommended. There is another side to that some people will say, is it, so radical betrayed partner stance, is it the right thing to do disclosure? You betrayed her, you gaslit her, you invalidated her for this long. She doesn't have the information. And even if divorce is on the table, do you owe it to her? Is that kind of making an amends to do that? And I've seen that happen where divorce is on the table. She went through disclosure, she got the information, she healed, and she decided to stay in the relationship. So there's, I'm not meaning to contradict you at all,
No,
Tammy.
no, no. I honestly agree with that. So and again, why you want qualified people and you want to be able to pick apart those nuances because, and we do get some CSATs that are like, and I think the rigidity does not help. You really do need, I think from an addict standpoint, like even if divorce is on the table, for me, if I'm going to have integrity, guess what? I need to do my disclosure because that will
Right.
help me on my
That's right.
journey, whether it helps my partner or not, but again, this is, and I know you get this too, Dr. Skip, if like we've done it ourselves, we've done a whole bunch of, I call them vomit disclosures because she's asking me questions. She wants to know. And I was like, her brain wants to know, but her heart is looking for you to stop this insanity, so getting qualified help, in all of this. But also the addict, wants to feel better. I want to come clean. And I was like, and you're vomiting on her, and she's left in the stench with no support. You've known all along you're doing this stuff. She didn't. And now and then guess what? You didn't do it in a way that was helpful. There's no pulling gathering the information together. There's no, this I do disagree with the whole narrative of all the gory details. I just see too many traumatized partners with that. So I think having it be like, yes, this accountability, financial, time, all of those things, taking ownership of that is so helpful for a recovery journey and helpful for a partner with proper support for each of you.
And now that there is another question, one last thing with this, just to seal up the original question. So, again, the International Institute for Trauma and Addiction Professionals, ITAP, they govern CSATs, but they have a certification called a Certified Partner Trauma Therapist. And then there is maybe what I would call a sister organization called APSATS, which is the Association of Partners of Sex Addict Trauma Specialists. So they also have a certification to deal with, partner betrayal on top of that.
And I just put app sets. I um, a couple things. Both organizations, I really want to fix their directories. I find their directories challenging. So I get frustrated with their directories. But there are, options on there. And I, well, I am going to go take the AppSats training this month, now that it's October. I took it along, I monitored it a bit, but I know that it's changed, over the years. And as part of my work, I know it will be useful to be part of that organization as well. So I do value that. And I do, when for partners, I am looking for people who specifically work with partners and do it from a pro-dependent lens.
Yes.
And guess what, there's a number of people who don't. Thank you. Yeah, but there's a number of people who still use codependent language, and that makes, that makes me we really want to provide support, from that other lens. So, and Dean, thank you for this. ITAA, Internet and Technology Addicts Anonymous. I've not even heard of that. I'm writing that one down. ITAA. Helpful for a lot of doom scrollers or compulsive scrollers. And part of our residential treatment, we actually are working, we're looking at, it's not just, porn and sex addiction. There's gaming, or, whatever else. There is a lot of scrolling, which is that mind numbing, compulsive place. So yes, in real recovery, we're looking across anything that is problematic for us, and is helping us escape in a unhealthy way, and check out of relationships. But I've not heard of that one, so I appreciate learning about that. Okay, Dr. Skip, the next one. Do any of your programs or team work with sex addiction with high narcissistic traits? It is diagnosed and painfully for real. He reluctantly came back when he started 12-step essay, but it's slow, and said, "This is me." He said he will read about narcissism, but is resistant. I could list all the traits and share with him, and there is an overlap with both. I pray that continuing the 12 steps will lessen the narcissism.
So we had a similar question, I think, on Monday night, and my clinical opinion. So I got out of graduate school for social work in 1996, licensed in California in 1999, worked in the San Francisco Bay Area for 10 years with severe mental health disorders, people that were locked up, basically. So I have relatively good diagnostic experience, and what I'm about to say is not to invalidate you or anyone else whatsoever, but you're saying that he's diagnosed with narcissism. I think it'd be interesting to look at where that diagnosis came from. Did he go through a full battery of psychological testing with probably a psychologist or somebody that's qualified to do that? Did he do the MMPI or the Milan, which are personality assessments? And the only reason I'm kind of harping on this is addiction and narcissism are so kind of entwined. And I think that narcissism has come in our vernacular, in our vocabulary, so much that all of us have narcissistic traits or features. But do we meet the criterion for a full-fledged narcissistic personality diagnosis? Very few do. And I'm not saying that your partner doesn't there, but I think that they kind of, addiction is inherently selfish, if you will. So, but do the programs or team work with sex addiction, high narcissistic traits? Absolutely. I am not affiliated with Seeking Integrity. I volunteer. I've led a group on this platform for 6 years because Dr. Rob is a social worker. His mission is to give back. Tammy talks about 1,300 videos that they've done. There are, I think, how many downloads, Tammy? Millions?
Oh, I don't even know, because like many of them have lots, the hundreds and thousands. So yeah, so
Right.
I'm on a single video. So yeah, I
Yeah,
didn't
yeah.
I didn't have that up.
And I know it's over a million, downloads because
Oh
I
yeah,
remember when that
yeah.
happened. Rob was saying that, and that was years ago.
Well, on the
And
podcast, I've had like 2 million
right,
downloads, and I
right.
don't keep up with that either. So
And these people, including Tammy, that are on there, are much more well qualified than I am with a PhD. Seriously, these people, Dr. Rob has written 11 or 12 books. There are people on there that are giving their time away for free, on this platform. And so Yes, they work with addiction and high narcissistic traits. Seeking Integrity, again, I'm not affiliated with the treatment center in Encino outside of Los Angeles, but they are specialists. They are experts that work with high narcissistic traits. The staffing ratio that you would get at that treatment center is like none other that is out there, and they do excellent work. So, yes, the programs and team do work with high narcissistic traits. Tammy, what did I miss?
No, I agree with all of that, and it isn't just sex addiction. So what Dr. Skip was talking about is addiction, and that is true. We have traits, and it is on a spectrum. And one of our webinars was on this topic, and it's like, well, you can say there's 10 different things, then you could be missing three of those. You could be missing seven of those. So, and can you learn to do things differently? Yes. If you have narcissistic personality disorder, it's a lot harder, but you said traits. And so I'm going to hold to that. I think well, I don't think, my experience is the more work that you do on this, you said he's going to 12 step. If he's going to one meeting a week, that's the slow path. If he's going to 90 meetings in 90 days, good. Hopefully during that time, you start to see little glimmers of hope during that. The more work we do, early on, I always say front load, get that, foundation started, the better. We did and as a good program, we did a webinar on 2/7 of 24, and I put the link in for the videos, but it was on navigating the 12 steps. If the SA meeting on Tuesday is a healthy one, great. If the SLAA meeting on Wednesday is a healthy one, great. I'm a board member for SCA, Sexual Compulsives Anonymous. If that's a healthy meeting in your area on Thursday, great. The foundation is very similar. Find a healthy sponsor. If he's not working the steps and he's just going to a meeting, again, hold your healthy boundaries. Don't expect change. You can go warm a seat for months or years and not really change. You hear good things, and in that meeting you go, oh, that was a good meeting. But if you're not doing the work. Early in my recovery program, someone used the elevator to recovery is broken. Please use the steps. And all these decades later, I still remember that, because guess what? If we work the steps, and we say in 12 step, it works if you work it. And it does. Just sitting and hanging out in a meeting doesn't really change us or change things for us. So the so so I'm not sure, um yes, he can learn. Real recovery, we did a webinar on that, I think in March of this year. It takes 2 to 5 years, and it can be on the 5 or more years if it's just barely doing anything. Addiction's a 24/7 issue. Like it's like diabetes. If I have a chronic condition, which addiction is, and I'm with diabetes, I'm eating properly, I'm taking care of myself, I probably won't have to endure the negative consequences of that disease. But if I'm, out eating ice cream and, sitting sedate, sitting, watching TV for, 12 hours, smoking, whatever. If I'm doing a lot of negative behaviors, guess what? The prognosis for me with diabetes would be poor. So at some point it's like, if we are willing, and that Dr. Rob talks about this all the time, that's the one thing we can't, we can't make somebody willing. But I also know no addict changes until the pain of change is less than the pain of staying the same. So in our 12 step materials, it talks about half measures avail us nothing. We stand at a turning point. At some point, we have to decide. Straddling the fence is painful and doesn't really get us anywhere. And honestly, Dr. Skip, I say this all the time too, is like, I think it's the worst place to be if you're not in your active addiction where you're escaping and numbing out, and you're not in recovery, so that there's promises of good things happening in recovery if we're willing to do the work. So you're sitting there not acting out and not really using recovery tools. It's a horrible place to be. And you know what? Lots of addicts, kind of stay in that. I'm abstinent from my acting out, but I'm not anywhere near sober or, on a recovery path. And I do, abstinence is just not doing the things we weren't supposed to be doing. I do hold sobriety as I'm starting to do things. Recovery is we live integrated. We are using these tools in all areas of our life. We aren't compartmentalizing like we did in our addiction. So it is transformative to those that do that. You partner, one more thing, and I'm sorry, you partner holding your healthy boundaries of like, yeah, I don't see this as really change, so I'm going to stay over here and take care of me, and we do have an expert residential treatment program for him that would also support healing for you too. Okay, I'm
And
quiet.
and I noticed after I took a breath and reread this that I missed the empathy piece here. I did the mansplaining thing, and I really, really do try to take a radically supportive and embracing partner perspective. And so, what I want to really say now is, I'm so sorry that you are going through this, and you have a partner that's reluctantly coming back and starting the 12 steps, slowly. Um, and not throwing himself in, to do the healing because personality disorders are super challenging, one of the most difficult things to treat, and they take a lot of work. And like Tammy said, it's not a 12-step meeting here or there. I really think it's that 90 meetings in 90 days. Again, I said that I went to, my memory is bad now, but I think I went to a meeting almost every day for 6 or 7 years of my sobriety, at least six. I've never left, the 12 steps, and more than, well, in 36 years, I've never left the 12 steps. And on top of that, I just went and did a couples intensive, over the weekend and doing therapy and, that sort of thing too. So it's lifelong work, even if you don't have a personality disorder. And I don't want to sound, you know, hope, like not give you hope. It just takes the work, and like Tammy said, the willingness is where it's at. So again, I'm just sorry that I missed the empathy in this piece and that you're going through this, and I too pray that continuing his work will lessen the narcissism.
So yes, and I'm honestly full of hope, even if it's only for you, because I know for sure that partners can find healing, even if he doesn't. So, and this is a continuation. 14 months since D-Day, addict's done it all besides residential treatment, still doubting how bad his problems are and debating definitions of diagnosis, changing CSAT again, still hasn't gotten a psyche evaluation because he's afraid to perform a certain outcome and says he feels all he does is perform, incapable of understanding his emotion, says he only knows anger and pleasure, knows he has a lot of shame, but has no resiliency for any of the work, gave up on him for 4 months, went back to acting out. That's a lot of data. Like,
Mhm.
and again, you get to choose. But he's telling you, like, even with as bad as it is, he's still wondering if he has a problem. Like,
Mhm.
goodness, like he was out of the house for 4 months. Not lots of negative. This is called denial. And addicts of all forms of addiction, we lie to ourselves. I get lots of people that are like, well, it's been 6 months. I'm still on step one. It's probably 14 months. I'm still on step one. I'm not sure my life was unmanageable. Like, it's mind-boggling even to me, who is an addict and sees this all the time, that someone can have that level of denial with all of that. So again, you have a known commodity of what he's telling you he's not willing to do. So what do you need to do? And you can stay in the house. We talk about this all the time. Partners can find a way to not let that person's behavior completely, ruin their days and steal all their joy, because this is hard. And so if you're focusing on what he's doing and not doing, like that just sucks all the energy out of you. And I invite you to go, regardless of what he's doing or not doing, I'm going to take care of me, because he clearly is choosing not to. I'm sorry.
And it's another continuation, Tammy. I'll pick up
Oh,
with this one. So he
okay.
feels hopeless, like he's willing to BS this whole thing as long as I'm willing to hang on. That even after 14 months, he's still just stuck in his own head and only doing something if there's a big consequence. But he's a sex offender. Okay. He doesn't get to be a lost cause, in my opinion. He has to recover, stay sober. Why aren't there better protections against offenders? Wow, that is a lot. Um,
Well, and uh, uh, it's easy to start talking about societal, we should do things differently. And that's a distraction. You have a sex offender living in your house who is denying that he has a problem, and so this comes down to what do you need to do to take care of you in this situation. And um, he doesn't get to be a lost cause, he has to know, like, we all want him to be in recovery and we want him not to do destructive things to himself and other people. And I can tell you for sure that, there's lots of people that I know for sure should be in recovery and aren't. So, and over the combined decades that we have, how many people can you think of that? Like, I mean, I know people who died of addiction, lots of people who died of addiction. They should have gotten recovery. So, he has to. Yeah, we all have to if we want to live on a different place, but we don't have to, because guess what? We still have free will. And as Dr. Rob says, if someone's not willing, you can't make them. I mean, he could be incarcerated and that would, but I think they still smuggle things into jail. So,
And I have just a little bit of a question here, not that it matters necessarily in this case, but there is another radical stance, like an Omar Minwala stance that would call sex addicts sex offenders, in that sort of sense. So
oh, so you're wondering if this
I'm
is
wondering if they're using
language being
that
used. Okay. Yeah,
now.
no, we use the legal definition of sex offender. Like, so yeah, and we do not use that language. Like, is the behavior offensive? Absolutely. Is it abusive? Absolutely.
Right.
But as soon as you start calling someone a sex offender, then I'm going like, okay,
Well,
CSATs aren't trained to treat sex offenders. That's a whole different legal definition. So I
and
hadn't
when we're
even thought of that because we don't use it. So.
sex offenders should not only apply. Okay, no, sex offenders should only apply to offending, not offensive. He's okay. Got it.
Oh, yeah,
Okay, so yes,
that
he
is
is.
absolutely a
Yeah.
legal thing. And,
Arrestable
yeah,
offense. Yeah.
yeah. And his consequences could land him, with, you know, a prison sentence. Yeah,
And
that's,
the next question we get all the time, do I think he has a personality disorder? So what I will tell you is if any therapist tells you that your husband has a personality disorder without meeting him, it's not ethical for us to diagnose. I understand 100% why you're asking this question. And, you're worried about him being antisocial. I think many betrayed partners wonder if their partner is antisocial, if they're not even offending. So I understand 100% where you're coming from with this question, but I don't have enough information, to diagnose that. And I see why you're worried. And again, I'm just so sorry that you're going through this. I have clients that their partners are offenders, and I have to do a lot of trauma work with them, EMDR work, because they have these awful visuals inside of their head of their husband offending, and the last thing they want to do is be sexual with their husband. They feel you know husband walking into the bathroom when they're changing, they feel violated, that sort of thing. So there's just secondary trauma that's put upon you. It's a whole nother level, and I'm just so sorry you're going through that.
and she adds, that I'm saying our marriage therapist said he may border on psychopathy. You again, we talked about CSATs early on. You want the right help, and so for these, you want the ideally someone who's ASAM, American Society of Addiction Medicine, trained addiction therapist, and has the qualifications to look at personality disorders, because otherwise, like, people go, oh, narcissist, well, there's addiction involved. Oh, well, that shifts things. We need to take that into consideration. You want somebody who's going to be able to look holistically at everything. So I'm going to tag on to Dr. Skip, though. It's like, what are you doing to take care of you? Because this is a scary situation. People have the police come and break down their doors and things like that. What are you doing to take care of you for all of the things for you, so that, let's say, because if he's still acting out, or not if, it's when he gets caught and ends up with legal consequences, that you are taking care of yourself, including financially, emotionally, physically, and spiritually, because this is there's trauma for you partner now, And when the FBI or police knock down the door, it's multiplied. So,
And I was just kind of throwing in the chat. Sometimes people think, what's the difference in narcissism and antisocial or sociopath? And so narcissists actually feel shame, but antisocial personality disorder, they lack remorse, they lack guilt, and it's scary.
and she added, she made him reach out for sex offender treatment, and I'm going to have to force him to go or report him. I'm worried about putting myself in danger reporting him though. And I don't know where you're located and all of that, but there's usually some hotline or something you can call so that you can get more information about what that would look like, or you can talk to, perhaps an attorney about all of that. So to clarify, Seeking Integrity works with some offender behaviors, non-touch. Sometimes they're, people have downloaded images, etc. But I do have a couple of programs that I do recommend when it is sex offender, and they both can work with both sex offender and sex addict. So somebody who has both. Not every sex offender is a sex addict. Clearly, not every sex addict is a sex offender. So I do have lots of resources, and if we aren't a fit, and we aren't for everybody, but if we are not a fit, then we refer to places that can help. But yes, find out what you need to do to take care of you.
And going back to that, Timmy, these are more
Yeah.
continuations.
Okay.
Um, and let's see. I just was reading the next one, so I got a side rail and
Oh, so
definitely
yeah,
talked
he
about.
says no empathy and no emotions, more
Yeah.
empty words to add to this difficulty. There is a new job 9 hours away. He's lost 5 jobs. I am tied to him financially, and we're in our mid 60s. So this is complicated, and why I try to find the right words to reach him. He did start Sex Addiction 101 with Scott. That's a good starting point. And if he's paying attention, so this is something else I had. This is a couple of years ago, but I had a partner that was in a somewhat similar situation where the financial tie was there, and I think there was some offender behavior, and so she was creating a plan for safety for her. And she was like, she had the long plan. It was like, it's going to take me a year and a half, but this is what I'm going to do. And so she was empowered because she was doing something that was moving her forward. So she wasn't feeling trapped in the relationship. Separately, there are, resources for partners, for women, whether it's, and reach out locally. There are resources for people who, are in a bad situation. So check, do more research, find out what your options are. Sometimes there aren't great options, but there's options.
So the next one is something that we get a lot, and I definitely want to clear it up. So it says that my characterization of Omar Minwala is completely off base. As an addict who has done trainings with him, I don't agree with you. He's very compassionate for both the addict and the betrayed partners. He's helped me turn the lights on to the magnitude of damage that I've caused in a no shaming and non infantilizing way. Just felt I needed to say that. Thank you both for all your amazing work. And
It was
I
probably more me because I have a strong reaction because I've been on there's a lot of backstory. So I'm glad it was helpful for you.
And I have a lot of clients that have gone to Omar Minwala and have found him very helpful and have done amazing work, definitely. And I might have misused the word of saying sex offenders with Omar Minwala. He definitely calls it an integrity abuse disorder there. So thank you for saying that to us. And I I hear where you're coming from loud and clear.
He interned with Dr. Rob a really, really long time ago. So, okay. Thank you for taking time to respond. You gave him 2 places to check out, and I know which ones I did. Hopefully he does it, but thank you for being a lighthouse in the storm. Okay. Um, and somebody else is tagging on with the Minwala, not about offending. Again, I, I'm glad that that has shifted. So I'm glad. And I'm sorry that you perceive that we avoid the abuse. We understand the behaviors are abusive. We do. But we, rather than labeling the person as an offender or abuser, and there are, domestic violence abusers, etc. But we understand that the behavior was, and we really want to separate that so that there can be healing. unfortunately, our experience is that sometimes people get caught in that, and that you're the abuser, I'm the victim, and that gap of helping heal the relationship is far harder. And we've seen that often in our residential treatment with people that come. So again, everybody takes what they need and leave the rest. Not here to defend or whatever. We really understand addiction, and we want to help people heal from the behaviors so that they aren't continuing to cause pain. I'm the betrayed partner. I have found my husband viewing adult porn on the TV and computer over the years. Then one day I found he had viewed underage porn. Does this mean he's an offender? Should I have reported him? Two different questions.
Um, So I, in the state of California, am a mandated reporter, which means that I have to report anybody that I know that has accessed or downloaded child pornography. And it really puts me as a therapist in a bind because how do people come to seek help if they know that I'm going to report them? And I also make that very clear to them. So I don't know that you are mandated or should have reported him or not. And the question about does it mean he's an offender? Again, I don't have enough information, but what I know about addiction is that oftentimes what people were doing at one time doesn't work and they up the ante. And then sometimes people will couple substances with, sex addiction and pornography. So they'll be drinking alcohol and then they'll stumble upon something, that is shocking to them. And they don't want to look, but they look, that sort of thing. And, it can kind of go there. So I don't have enough information to know whether he's an offender or not. But I don't think in my clinical expertise, the clients that I've had that have actually watched child porn, I don't know that they're necessarily offenders. And there's offenders is a whole different topic. You have dedicated offenders. I'm using age terminology, but people that, only have an arousal to like prepubescent children. And then I'm trying to think of what the other word is, but they're non-dedicated, you know, that their arousal template is more active. So, Tammy, what did I miss about that?
No, and you're right. It's California and Pennsylvania. And I think there was one other state I heard about recently that have mandated, as soon as you hear about something, you have to, and that prevents an addict from getting the help that they need because we should not be holding secrets if we're, so if we can't tell our therapists about behaviors because they have to report us, but those are the laws in those states. So, I don't know that you should report him, but I do see the escalation because you're saying, my husband has been viewing porn, on the TV for years and computer for years, and now you've seen this. So addiction escalates and things, and Dr. Robin often talks about like things that we didn't know about, we discover in porn, and then that becomes part of our arousal template. So my concern would be if he is still just, scrolling around on TV and computer and doing porn, then you have someone probably with active addiction, and it could get worse and, then more negative consequences. I was talking to somebody not too long ago that I talked to a while ago, about a year and a half ago, and he really needed treatment and he wasn't willing at that time to get treatment. And now he's lost, family, like, and he's about to lose a job, like all of those things. And he's like, I wish I would have come, back. And I said, you weren't willing, you weren't ready yet. Now you are. So you can come and get the help that you need. And so, like, I hope that your husband does not wait till really negative consequences happen to get help, to stop those problematic behaviors. And you can express your concern. I can tell you lots of stories about, how negative it can get, but he can choose, if it's all online porn, I'm going to pull it. We've got the Porn Addiction 101 work group starting again this month because now we're into October. And so we have a Porn Addiction 101 work group starting this month. But again, that won't be enough. So it really is, what is he willing to do to to get help? So, but you taking care of you, if you didn't join the boundaries work group that started last night, you could still join. It's healthy boundaries for you can be amazingly helpful. Okay, so the next one, Dr. Skip, do you think gaslighting is used too loosely? My husband is bothered by the word. He listens to too much politics, but he is a master of it. I have used the word just a few times in a more of a pattern of abuse and lying in reference to relationships. We had an excellent webinar um, with Tara Beals Gomez and Sarah Morales on demystifying gaslighting in the previous, I put the link for the previously recorded webinars. Check it out. It was brilliant. And like they have slides and it's intention. Oh shoot, I can't think of it off the top of my head, but it was, your intention might not have been to gaslight, or it could have been, so how, what your intention was and what the result are can be two different things. So that may be useful for you, but could be useful for him too, because he might go, oh, I didn't intend to do that, but I can see how my actions, behavior, could look like that. So, and the other aspect of it is, again, Debbie McCrae, who does the boundaries work group, she's really good at saying, the story I'm telling myself that when you did that is this. And so therefore I'm going to, the 4-part talking boundary is really helpful for addressing gaslighting. So arguing with somebody about it who's not in a recovery place and not willing to take ownership doesn't really, it just gets to be a tussle. So,
And just to piggyback on that, do I think the term is used too loosely? I know it's becoming more popular in our everyday vernacular, but is society perhaps waking up? And basically how I look at gaslighting is invalidating or crazy making me feel, kind of crazy is the definition I use for that.
okay. So then the next question is, and I was going to start typing an answer, but I'll cancel on that. So if we went to a therapist and we mentioned the underage porn and it's been years, would it be reported by the therapist?
Yes,
And you can speak to California, and Pennsylvania has a similar,
yes, it would.
yeah, but
Unless it had been reported before, which doesn't sound like
correct.
it. Yes.
Yes, but I suspect in your stuff that the paperwork that you have, like I
Yep.
consistently hear from therapists who are in these states that say in my paperwork it says, if you share this, I will have to report it. So they are pretty clear, about the reporting. So, and that is different than like at 12 steps, they are not mandated reporters. So at 12 step, but we also are not just talking about, the terrible stuff we do. We're talking about how do we not do those things. So,
Yeah.
okay. Um, oh, let's finish with this. If it's reported, what are the consequences?
Well, it depends on what the consequences are. If it's reported, it's probably a lot better thing than them finding out, because I do have clients that literally were discovered and had the FBI break in their door with AK-47s and drag everybody out on the concrete in their underwear, face down, kind of thing. The consequences, I'm not sure legally exactly what's going to happen, but it's definitely better to, report than to be discovered. I don't want to make you paranoid though.
And no, and I don't either. Yeah, and again, self-reporting. Also, with the, if you're reporting, then and I'm going to residential treatment to get the help that I need to do. I mean, like there are ways that can be helpful to mitigate that. So, but getting the help, I mean, honestly, because otherwise it's like it's still just hanging there. So you get help and support. Okay, so then the last one. Oh yes, this recording will be posted, but it'll be posted next week because Scott's away. So the last question is, what's the likelihood of them ever coming in for help themselves? Plain porn addicts didn't come in for help unless forced by a loved one or law. It's more important not to scare the 1% that might come tell you and that they watch child porn, or keep consequences high for those who do that do. Not all PAs are going to child porn. That's true. If you do go to child porn, that's a problem on top of addiction, in my opinion. Exact, yeah, and that's why sex offender treatment is different than sex addict treatment. And then I always say it's the Venn diagram, so there's that overlap of people who are in both categories. And yes, that is why, like Dr. Rob was one of the people that was, working to combat the California law when they were looking to put it in, because there were lawmakers that were going like, we just need to stop all of this and make them all offenders. And when you call, it's like, you watch some image, you don't know who it is, so there's not an identified person. If you're creating the porn, that's a whole different level. That's a whole different level. But it the whole system doesn't make sense, and it does keep people who need help from being able to
Yes.
get help in a legitimate way. We should be able to tell all of our things and not have to, parse it out. So we agree, again, another thing that we have zero control over. But lots of people in California and PA get help even for issues like this. So
Yeah.
okay, thank you, Dr. Skip. Thanks everyone for the questions. We're glad you were here. And yes, the video will be posted. It'll just be next week, after Scott gets back from his vacation. So thank you so much, everyone.
Yeah. Thank you for having me, Tammy. And thank you everybody for showing up today. Everybody have a
Yeah,
wonderful afternoon.
grateful for it. Bye-bye.